Hi, Dr. Kiwan. How are you?
I'm good, thank you.
Thanks for giving us your time today.
Most welcome.
Thanks for accepting our invitation. Today, I would like to know and understand more about stem cells, regenerative medicine, specifically in the field of cardiology, because I'm hearing a lot about regenerative medicine in cardiology. And are you ready for some questions?
Yeah, please. Thank you very much. I'm ready. Go ahead. Do you have anything in your mind? I'm
Yes,
available.
of course, a lot.
Yeah.
So, first, I would like to know what is regenerative medicine and specifically in cardiology.
Okay, look, this is actually a very important question because before we go into deep details, we need to know the simple definition of regenerative medicine. Regenerative medicine is the process of repairing, regenerating, replacing, tissue engineering, damaged or diseased cell or tissue in the body and replace it by different modalities of regenerative tissue in order to restore a normal function of the organ, as simple as that.
Great. So I would like to know more. What are the applications of regenerative medicine in cardiology? How we should use that in cardiology?
Yeah, look, in cardiology, we have, you mean the different modalities of
What are
regenerative
the
medicine?
applications, basically?
Yeah, so we have stem cell therapy, we have acellular therapy, which is stem cell products like exosome, we have tissue engineering products, we have gene therapy, we have immune cell therapy, we have biomaterials, and on top of that, we have regenerative pharmacology. So all these constitute what we can offer in regenerative medicine in general and also in regenerative cardiology. Yes.
So basically, these applications that you named, can you please explain more about how we can use them in cardiology for different conditions?
Yeah, definitely. It's a very important question, because we have different products, we will use these different products in different application in cardiology. The first product is stem cell therapy, which is the common one we use in cardiology. There are many clinical applications of stem cell therapy in cardiology. Number one, in post-myocardial infarction, we give direct coronary injection to prevent the progression into heart failure. The second application is intracoronary or intravenous application in patients with already having heart failure to improve the left ventricular function, to improve symptom. And many of these people who receive stem cell therapy has actually been removed from the transplantation list. We have also application of stem cell therapy in intractable chronic angina, which is resistant to many medications, and we have clear evidence that the patient has significant improvement treated with stem cell therapy compared to medical treatment. But this is stem cell therapy. We have gene therapy applications in cardiology. We have gene application in hereditary chronic cardiac conditions. There are 2 trials already on application of gene therapy in Duchenne muscular dystrophy with cardiomyopathy. It's a very difficult condition to treat. There is an ongoing trial in arrhythmogenic right ventricular dysplasia, and there are many preclinical animal study already ongoing. So this is the second application, is gene therapy. We have very important weapons in our hand, which is cardiac tissue engineering. Cardiac tissue engineering is a brand new modality in cardiac regenerative medicine. There are techniques of using cardiac tissue patches implanted directly on the myocardium in a patient with ischemic cardiomyopathy with very promising result. We have acellular tissue valve has been implanted in patient with congenital heart disease, especially in pulmonary atresia and pulmonary stenosis. And we have engineered a vascular conduit or artificial vessels approved actually by the FDA, being used in peripheral vascular disease. So there is really good progress in regenerative cardiology application.
I think you named very amazing applications. I'm also interested to know more. But first, I need to understand that are there any approved therapies or any ongoing clinical trials?
Yes, definitely. This is very, very important question because we were talking about regenerative cardiology and regenerative cardiology. People need to know, are we talking sense or not? So I can tell you we have three types of clinical trial. We have registered clinical trial, we have already published clinical trial, and we have ongoing clinical trials. Now, there is like a website called clinicaltrial.gov. This is an American website.
Yeah.
This is developed by the FDA. Now, any organization or research group want to talk about or register a clinical trial, usually they go on this clinicaltrial.gov. So we have more than 1,100 clinical trial already registered on the clinicaltrial.gov. Now, out of this more than 1,000, we have more than 500 published phase 1, phase 2, and phase 3 clinical trials. Now, what this clinical trial already showing? Two things. Number one, all the clinical trial has clearly demonstrated the safety of stem cell therapy, number one. Number two, many of these trials has shown clearly the superiority of regenerative medicine in showing clear evidence of repair of cardiac muscle, and this is reflected on symptoms, on survival, and on decreased hospitalization. So there is no doubt these are published study. Now, I just want, while we are here, although it's not related to cardiology, but the FDA already has approved probably more than 24 regenerative medicine products for the treatment of different conditions. Number one, there is approval for cell therapy or immune cell therapy or CAR T cell therapy for patients with acute lymphoblastic leukemia, certain type of lymphoma, and prostate cancer. The FDA also has approved many gene therapies for the cure of the following condition. There are many like visual condition has been treated with gene therapy. We have hemophilia A and hemophilia B gene therapy. We have sickle cell disease. We have cerebral dystrophy. We have melanoma. And we have many other conditions approved by the gene therapy by the FDA. Now, the third FDA approval is tissue engineering. Now, tissue engineering recently, just a few months ago, the FDA has approved acellular tissue engineered vessel. This vessel is used in clinical trial for the treatment of acute limb ischemia, and also it can be used as a conduit in congenital heart disease.
So you named very amazing thing that research centers and universities are following up with the FDA regulations, US FDA regulations. But if we want to go beyond US and FDA regulations, are there any ongoing clinical trials in any other countries that cardiologists should be aware of?
This is, again, a very important question because we always say FDA. I agree. I gave you some example of the FDAs, but I can reassure you that the world has started so early in regenerative medicine. There are many countries already start. I'll mention that later, but let me start with the ongoing clinical trial in cardiology outside the US. There are many ongoing trials. In Germany, there is an ongoing trial for the treatment of patients with ischemic heart failure using tissue engineering, tissue patches, cardiac tissue patches, with very promising results. We have in Japan also, there is an ongoing trial using induced pluripotent stem cell cardiac spheroid to repair damaged myocardium in patients with heart failure. There is a trial going on same time in France and UK called Excellent Trial. Excellent Trial is a trial of patient with acute myocardial infarction given stem cell therapy to prevent the development of future heart failure. This is ongoing. We also have very good news that from Iran there will be an article or a study, which is the biggest actually study on patient who is already having heart failure to prevent, myocardial infarction, to prevent heart failure. Patient presented with acute MI, primary angioplasty done, intracoronary stem cell therapy infused, and the result of that trial is really amazing. It's called PREVENT trial, and we were able to prevent the development of heart failure in these subsets of patients who receive intracoronary infusion. And there is a trial in South Korea, ongoing trial, also using stem cell product in patients with acute myocardial infarction to prevent the development of heart failure. So this is the one which is already ongoing in cardiology. But I cannot really resist myself of telling you the history of regenerative medicine approvals. The first approval of regenerative product was done in South Korea in 2010, which is 15 years ago. They approved the stem cell therapy for osteoarthritis, myocardial infarction, Crohn's disease, and rejuvenation. The second approval came from Japan in 2015, 10 years ago, for the treatment of graft versus host disease and spinal cord injuries. We have approval in Europe in 2015, also for treatment of Crohn's disease and corneal disease. The USA has approved stem cell therapy for the first time. I told you there are stem cell products by FDA, but a stem cell therapy treatment for graft versus host disease, just published recently, approved by FDA in patient who is steroid-resistant GVHD. We have in Iran in 2016 stem cell therapy approved for osteoarthritis. In India 2016. In China recently, 2025, stem cell therapy been approved for GVHD. And the most important information, and I would love to tell you, Nugeen, is that Florida, which is a U.S. State, the Florida in July 2025, what they made a decision that to allow a non-FDA approved cellular product to be treated for patient with orthopedic conditions, with wound care, and with the pain management. So that's really a new development inside the states, that Florida is easing off the regulation away from the FDA. So we're really very happy that regenerative medicine has been there for more than 15 years, but we hope that other countries will move and ease off the regulation.
So with this bright future that you just mentioned, I think there should be something unique with the stem cells and regenerative medicine. What are the differences between regenerative medicine or use of stem cells compared to the current therapies for cardiology conditions?
Very important question again, because we really need to know why we are saying regenerative, regenerative, regenerative. The uniqueness of stem cell therapy or regenerative cardiology in general, that number one, or stem cell, it repair and regenerate disease or damaged myocardium. That's number one. Number two, it replace a myocardial scar tissue with normal myocyte, and this is proved by MRI. Now, the third thing, we know the stem cell can cause direct regeneration of damaged myocardial cell. The stem cells have a paracrine effect. This means they can secrete an exosome or cytokines, which has a direct effect to help the repair of the surrounding damaged cell. The stem cell have a tendency for immunomodulation. They act as anti-inflammatory. They can create a new blood vessel formation by a process called angiogenesis. And because of this unique action, the stem cell has, compared to medical treatment, has significantly reduced the patient's symptoms, has significantly reduced hospitalization for patients with heart failure, has significantly improved survival of patients living longer on stem cell therapy. And on the top of that, many patients, I'm repeating this word many times, many patients with heart failure, it had led to improvement in their left ventricular function and has been removed from the cardiac transplantation list. So what is the impact on health care and the health cost? That definitely people who receive stem cell therapy, there is a positive impact on the cost of health, and that would, due to decreased hospitalization, decreased mortality, and so on. So this is why we always believe that the future is with regenerative cardiology.
So, Dr. Kiwan, I think there should be a gap between clinical research and the actual application. How do you think we can close this gap and educate our physicians to at least go and do the clinical trials and come up with new ideas or therapies?
Yes, and again, I think you are really pushing me to talk about our fellowship. Because of the knowledge gap, which is currently, especially in cardiology, about regenerative cardiology, we developed, the American Board of Regenerative Cardiology has developed a diploma and fellowship program to close the gap, the knowledge gap between medical treatment and regenerative cardiology. So what the fellowship is offering to close that gap. Number one, the fellowship is offering a fully comprehensive program and many modules. We'll come to that maybe later. We are covering general regenerative cardiology. We are having modules on tissue engineering. We have modules on and knowledge on acellular therapy. We have modules on immune therapy, on gene therapy. And on the top of that, we really have good modules and many lectures on clinical applications. In clinical application in chronic incurable cardiac condition. We have clinical application for the treatment of ischemic heart failure, for the treatment of cardiomyopathy, for the treatment of intractable angina, for treatment of pulmonary hypertension, treatment of congenital heart disease. And on the top of that, also, we are producing modules on the laboratory part of stem cell therapy, which is very, very important. As we know, we are physicians, and on the other side, there are scientists who are really mainly concerned about producing the cell for us and giving us the knowledge. So this is number one. We have modules and knowledge. The other thing, the KCRM is crossing the bridge. There is really a big bridge between laboratory medicine or laboratory science and the clinical application.
Exactly.
So what we are trying that with the producing practice guideline, policies, protocol, clinical learning, we're trying to cross the bridge between the lab finding or the lab research and the clinical application. And on top of that, which is number three, that KCRMF is producing very comprehensive roundtable discussions about mainly the clinical applications and the laboratory applications, run by 16 faculty members, each of these members having their own subspecialty in regenerative cardiology. So we're trying our best to cover all the topics of regenerative medicine and covering the laboratory part and the clinical part. And I hope once it will come to reality that we are doing really something helpful and supportive to our colleague cardiologists.
Exactly. That's a great step that you take. Thank you so much. So Dr. Kiwan, how does KCRMF course, how does it deliver? What's the education format like?
Yeah, I think this is a very important question to know for people who are interested to introduce themselves to the course. The course format are number one, an open online video lectures of more than 80 video lectures recorded by the international faculty. In addition to that, we have more than 40 modules, a PDF and PowerPoint modules. And number three, we have an online library. We tried to collect articles. We have more than articles already uploaded for covering all regenerative cardiac subspecialties. And the most important one is we have a review course. This is a 3 days hybrid course in Dubai, UAE, that we will review roundtable discussion, interactive discussion, laboratory exposure to regenerative cardiology. We have also condensed review courses of whatever done over the 80 modules. And at the end of that, we will have a dual exam. We have the exam for the general diploma of general regenerative medicine, and we have the fellowship exam for the cardiology fellowship program. So that's in general an idea about how it is run. Now, I will talk a little bit about the modules. The modules cover a basic science of regenerative cardiology. We have the pathophysiology of regenerative cardiology. We have modules on atherosclerosis, on ischemic heart disease, modules on cardiomyopathy, on congenital heart disease, modules on gene therapy, tissue engineering. And again, we have modules of clinical application, like clinical case scenarios. So we will have real cases on patient presented with myocardial infarction, stented and given stem cell therapy, patient with a chronic heart failure given stem cell therapy, patient with pulmonary hypertension, and so on. So these are the clinical case scenario, also included as part of the module. So I think it will be very, very detailed and fully comprehensive modules.
For registration on this course, who is eligible and what is required?
I think this is also a very important question, because we increase the eligibility, make it more wider. We included cardiologists, which is adult and pediatric cardiologists. We included cardiac surgeon, adult and pediatric cardiac surgeon. We thought that intensivists also should have an exposure to this fellowship. We also believe any internal physician, internal medicine, who is interested in general cardiology can also apply for this fellowship. There is a new subspecialty came to the market, if you like to call it, is longevity medicine physicians.
Yeah.
I think longevity medicine physician also they can apply to our fellowship program. So it's really a wide range of physician.
Yeah, that covers a lot. Dr. Kiwan, one more question. What are the challenges that cardiologists might face if they want to apply regenerative medicine and put it into practice, and how they can overcome these challenges?
Very, very good question. Actually, there are so many challenges for cardiologists in general in regenerative medical path. Now, the first challenges are regulatory approvals. You know, it's very important to follow your...
That's a real challenge.
It is very real challenge. I'm sure you know that. Your health authority, each health authority in each country, they have their own approval. And because regenerative cardiology is really a brand new field, so the regulatory mechanism is really very challenging and very hard, because there is each country has its own standards, has its own guideline, has its own policies and protocol, and each country guideline is different from other countries. So the regulatory approval is the paramount importance. Number two, access. This is also very important. Access and availability of or stem cell therapy facilities producing the product for regenerative medicine. So it is not always available, and to get a stem cell facility, to build up a stem cell facility, it needs a lot of regulations and very special regulations. So that's another challenge. Now, the most important challenge to me is the availability of education and knowledge and certification program to teach doctors what is regenerative medicine. And currently, the American Board of Regenerative Medicine has created a lot of programs. One of them is the diploma of general diploma of, and this is the first fellowship in the world or worldwide, which is in cardiology, called Kiwan Cardiac Regenerative Medicine Fellowship. So availability of education and certification program is a big challenge and is not always available in each country. Now, the other thing is the availability of research centers. Now, stem cell therapy really always need a research center, research application, clinical trials, and so on. That's also not always available in many countries. That's why the role of the American Board of Regenerative Medicine come into play to help doctors in general and cardiologists especially to reach their dream of learning and education in the field of regenerative cardiology. Very important
Definitely.
things.
And I think basically how knowledge and how science will progress is by questioning. If you don't have any questions in your mind, you will not progress. You will not try to find new ways. So that is very important.
That's why I'm working, me and you and my colleagues working so hard to try, I don't want to say educate, but at least help our colleague to reach this knowledge and information to them, to help them to be attracted for our courses and our fellowship program.
Dr. Kiwan, what's the perspective of regenerative medicine in cardiology for the next 5 to 10 years?
Yes, I think this is a very, very important question. We are very optimistic. And I think the regenerative people in general believe in the coming 5 to 10 years, a lot of development will happen. and regenerative cardiology will evolve from an experimental field into a standard care daily therapy. That's number one. And number two, regenerative cardiology will be personalized because we have many products in regenerative cardiology or medicine. So we can personalize the treatment depending on the patient genetic, cellular, or physiological profile. So allowing for direct repair of the patient condition, personalized. And number three, the innovation in cardiac tissue engineering is really progressing very well so that we could have a 3D bioprintable cardiac patches where we can stick these patches directly on the myocardium in patients with chronic ischemic heart disease. Now, the progress in gene therapy, we could discover the special gene to treat any genetic cardiac conditions before it get developed into severe progressive disease. In that case, we can halt the development of heart failure in certain patients with gene therapy. Now, because of whatever I mentioned, I am expecting by 2035, there will be very few patients admitted to hospital because of heart disease. It means we will reduce the number of patients admitted for heart failure. We will definitely reduce the mortality of people with chronic heart failure. We will definitely decrease the list and the number of people waiting for the cardiac transplantation. The last comment, if you allow me to mention, I recently came across a book called The Death of the Death. The name sounds very strange, but the authors of the two authors of that book, they clearly indicate that in the future, there will a healthy life will be prolonged, and most of the chronic incurable disease will be cured. And according to them, most of the causes of death will be either wars or accidents. So this is the future in the coming 5 to 10 years.
Hopefully
Inshallah.
everything goes well. Thank you for the all really valuable information that you gave me. But this is my last question. I would like to know your personal opinion for the future of regenerative medicine in cardiology. What do you think about that?
Thank you for asking me this question. Actually, maybe you don't know my background. I have been doing coronary and cardiac intervention exactly since 40 years. When we started, we were very restricted to do procedure in very, very selective. My colleagues, they know, for example, coronary, very simple coronary lesions, and we are not allowed to do complex cases. Now, over the years, now cardiologists can do all vessel disease during coronary angioplasty. So I am quoting the father of modern organ transplantation, Dr. Thomas Starzl. He said more than 60 years ago, he said, the history of medicine is that what was inconceivable and unbelievable yesterday and barely available today often become routine tomorrow. And for me, the regenerative cardiology will become routine at one day and is not very far. Thank you, Nogin, and for your time. And I'm really pleased that I gave whatever I can tell. And we leave it for our cardiologists to make decision whether they like to join regenerative cardiology program or not. We are doing our best. We will continue our education. And as I said, whether I am dead or alive, we will know this will become a reality.
Exactly.
Thank you, Nogin, and thank you
Thank you so much for this very informative interview. And I really look forward to have more clinical trials, especially in our region, because I think this region is very capable of doing a lot more. Thank you so much. Hopefully we will see you again. Thank you.